Are you a therapist trained in EMDR but are unsure if it works virtually? It absolutely does, and let me tell you more on modifications to make for virtual therapy. I'm Holly, I'm an EMDR therapist, and I'm an EMDR-approved EMDR basic trainer. And so all the same modifications you're going to make for regular online therapy are going to be important. Having a protocol of what happens if you get cut off. Do you call the client? Does the client call you? Making sure there's safety, making sure there's no one else in the space. All those same things you're going to do for EMDR. The biggest modification is really going to be how do you apply the bilaterals. Now, you don't want to be sitting back going like this because that's not going to really work virtually. And so if you're using eye movements, the most important thing, especially if you're using them on the screen of the computer, is that the client is on a computer and not on an iPad or their phone. Their eyes will not cross the midline if that's the case. They might move a little bit, but it's not going to get that full sweeping crossing of the midline. And so you want to make sure they're nice and close to their screen. It should be like a foot to 18 inches in front of them, just like your hand would be if you were in person. I have a ball that I actually send people. So there's a link, I send it to them, and they follow the ball back and forth as I'm watching. Now, if they are on a phone or an iPad, you can just have them look at 2 points. They're kind of equidistant in their room. So I'm going to show you. I'm looking at my degrees on the wall over here. And you can see my eyes crossing the midline here. That's totally fine. You would just give them the cadence and tell them when to stop and when to begin. And the same as with tapping. People can tap on their shoulders like this, or they can tap on their knees. And you just give them the cadence, left, right, left, right, left, right. And you'll say, okay, I'm going to let you know when to start, and I'm going to let you know when to pause. I always say pause instead of stop. If someone's in the middle of a trauma memory and you say stop, that can feel intense. And then for auditory, if you do have a clinical reason to use it, you could get headphones. And the program I use online, which is bilateralstimulation.io, I use that for the eye movements. It also has an audio setting where they can plug in. But audio, you just do like this. So turn your head like that and then tap like this. And this is actually auditory and tactile. And so you get 2 for 1. That is my favorite way to do auditory. And so really the biggest modification is around those pieces. And there's actually more pros than not. The client isn't going to potentially be late to the session. They can actually have their animal with them. I have people who will have their dog on their lap. Cats aren't always so nice, but they get to have like a pet in there with them. They have a weighted blanket. They can have their own tea that they like. I've had clients who maybe want to stay grounded and